Your brain can hide a ticking time bomb for years, silent, painless, invisible, until one sudden moment changes everything forever. Tonight, you'll discover the terrifying signs your body whispers before disaster strikes, and why missing just one could cost a life. Welcome to Wellness Unfolds, your trusted guide to understanding the complex signals your body sends about your health and longevity. Just like a bustling city at night, the human brain is a complex network of pathways that never truly sleeps. Deep within this biological marvel, miles of delicate blood vessels work tirelessly to transport oxygen and nutrients to every neuron. In a healthy system, these arterial walls are strong yet flexible, easily handling the constant pressure of your beating heart. However, time and various risk factors can silently compromise this structural integrity, creating a hidden danger known as a brain aneurysm. This condition begins when the constant force of blood flow creates excessive pressure against a weakened section of the artery. Over time, the vessel wall loses its elasticity and begins to bulge outward, much like a weak spot on a tire. As this balloon fills with blood, its walls become incredibly thin, making it susceptible to leaking or rupturing without warning. This formation is what medical professionals call a cerebral aneurysm, a silent threat that often grows without causing any initial pain. For many elderly individuals, these ticking time bombs remain undetected until they press on nerves or, tragically, until they rupture. High blood pressure, genetic predisposition, and the natural aging process all contribute significantly to the weakening of these vital arterial walls. Inside the sac, blood flow becomes turbulent, further stressing the tissue and increasing the risk of a catastrophic medical event. Understanding the warning signs is absolutely crucial, because early detection can mean the difference between full recovery and permanent disability. Today, we will identify 8 specific symptoms that every senior citizen and their caregivers must know to prevent a tragedy. The first and most famous symptom is a sudden, severe headache, often described by survivors as the worst in their life. This is not a normal tension headache or migraine. It strikes instantly and reaches maximum intensity within mere seconds. Doctors refer to this specific type of pain as a thunderclap headache because it hits with the violence of lightning. Unlike regular headaches that build up slowly, this pain is explosive and may be caused by minor blood leakage. The pain is caused by blood escaping the vessel and irritating the sensitive, protective membranes that surround the human brain. If you or a loved one experiences this sudden explosion of pain, do not wait or take painkillers. Call emergency immediately. The second warning sign involves sudden changes in vision, which can occur when an aneurysm presses against the optic nerves. Patients often report seeing double images or experiencing a sudden blurriness that cannot be corrected by blinking or rubbing eyes. A drooping eyelid on just one side is a classic sign that an expanding aneurysm is compressing the oculomotor nerve. The expanding balloon takes up space inside the skull, physically pushing against the delicate nerves that control your eye movements. This symptom may also present as a blind spot or a complete loss of peripheral vision in one specific eye. Any sudden loss of vision or visual distortion is a medical emergency that requires immediate scanning of the brain's vessels. The third symptom is often mistaken for a muscle strain, but is actually a sign of serious irritation in the spine. This is not a simple stiff neck from sleeping wrong. It is a rigid stiffness that makes lowering the chin impossible. When blood leaks from an aneurysm, it enters the spinal fluid and travels down the neck, causing inflammation of the membranes. This condition, called nuchal rigidity, is a protective reflex of the body, trying to immobilize the irritated spinal cord area. If a severe headache is accompanied by a neck so stiff you cannot touch your chin to your chest, seek help. Doctors check for this specific stiffness as a primary indicator of subarachnoid hemorrhage, a type of bleeding caused by aneurysms. The fourth symptom involves the digestive system reacting violently to changes happening inside the brain, specifically increased pressure. Sudden nausea and vomiting, especially when not related to food, is a sign of rapidly increasing pressure within the skull. As the aneurysm leaks or expands, it disrupts the delicate balance of cerebrospinal fluid, triggering the brain's vomiting center immediately. This symptom is particularly dangerous because it can lead to dehydration and further increase the pressure inside the head during straining. When vomiting is accompanied by that severe thunderclap headache we mentioned earlier, it is almost certainly a neurological emergency. Never ignore sudden vomiting combined with head pain, as it indicates your brain is under severe stress and needs relief. The fifth symptom is arguably the most dangerous because family members frequently mistake it for normal aging or simple daily fatigue. We often dismiss confusion in the elderly as dementia or tiredness, but sudden onset confusion is a major red flag. It involves a sudden inability to understand language or express thoughts clearly, leaving the person feeling isolated and deeply confused. Sudden confusion or difficulty understanding speech indicates that the aneurysm is pressing on critical cognitive centers within the brain tissue. This disruption in communication happens because the brain cells responsible for language are being deprived of oxygen or compressed. If a sharp, articulate person suddenly cannot form a sentence or seems lost in their own home, act immediately. Medical teams use these speech patterns to locate exactly where the bleeding or pressure is occurring within the brain's hemispheres. The sixth symptom is a seizure, a terrifying event caused by an electrical storm inside the brain due to irritation. When blood leaks into the brain tissue, it irritates the neurons, causing them to fire rapidly and without any control. This creates a seizure, which can manifest as uncontrollable shaking, staring spells, or a complete loss of bodily control. Seizures are a direct sign that the brain's cortex is being irritated by the presence of a foreign substance, blood. For many patients, a seizure is the very first sign that an aneurysm has ruptured, making it a critical emergency. Even if the person has never had epilepsy before, a sudden seizure in old age often points to vascular problems. The seventh symptom mimics a stroke, presenting as sudden weakness or total numbness affecting only one side of the body. This happens because the aneurysm is disrupting blood flow to the motor cortex, the area responsible for controlling muscle movement. You might feel a sudden heaviness in your arm or leg, or a complete inability to lift them against gravity. Just like a stroke, the symptoms usually appear on the opposite side of the body from where the aneurysm is located. Facial drooping is also common. If the smile is uneven, it confirms that the brain's control centers are under attack. Doctors use the arm drift test to confirm this weakness, which is a hallmark sign of compromised blood flow in the brain. The eighth and most severe symptom is a sudden loss of consciousness, indicating the brain is overwhelmed or critically deprived of blood. Fainting occurs when the pressure inside the skull rises so high that it stops blood from entering the brain tissue. This is the body's desperate attempt to reset, but in the case of an aneurysm, it signals a massive rupture. Immediate medical intervention is required to reduce the pressure and stop the bleeding before permanent brain damage occurs to the patient. Unlike simple fainting from heat or hunger, this loss of consciousness is deep, prolonged, and often accompanied by irregular breathing. Recognizing any combination of these 8 symptoms can empower you to act swiftly and save the life of someone you love. Time is the most critical factor. Every minute that passes without treatment results in the loss of millions of brain cells. Modern medicine offers incredible treatments, from surgical clipping to endovascular coiling. But they only work if the patient arrives in time. Recovery is possible, and many people go on to live full, happy lives after treatment if the signs are caught early. Your awareness is the first line of defense. Watch your loved ones closely for these sudden changes in their health. Thank you for watching Wellness Unfolds. Please subscribe and share this vital information to save lives and protect your loved ones. Remember, knowledge is power when it comes to your health. Stay vigilant, stay informed, and take care of your amazing brain. While we cannot control genetics, adopting a heart-healthy diet rich in antioxidants can help strengthen your blood vessel walls naturally. Gentle, regular exercise helps regulate blood pressure, reducing the daily stress placed on the delicate arteries within your brain. Quitting smoking is the single most effective step you can take, as tobacco smoke directly damages the integrity of arterial walls. Managing hypertension is non-negotiable. Keep your blood pressure in the safe range to prevent the ballooning of weak vessel spots. Regular checkups allow your doctor to monitor these risk factors and screen for aneurysms if you have a family history. By understanding the mechanism and symptoms, you transform from a passive observer into an active guardian of your own neurological health. Let's review one last time. Watch out for that thunderclap headache that strikes out of nowhere with terrifying intensity. Be alert for vision changes, double sight, or a drooping eyelid that appears suddenly without any prior history of eye problems. Check for a stiff neck that makes it impossible to lower the chin, especially if it accompanies a severe headache. Don't ignore sudden nausea or vomiting that isn't connected to a meal, as it signals rising pressure in the brain. Pay close attention to sudden confusion or speech difficulties, often the most subtle yet dangerous sign of a neurological event. React immediately to any seizure activity, which indicates that blood is irritating the brain's electrical system and requires urgent care. Test for weakness or numbness on one side of the body, a classic sign that mimics a stroke but needs treatment. And finally, treat any sudden loss of consciousness as a life-threatening emergency that demands an ambulance call right away. Diagnostic tools like CT scans and angiograms are powerful, but they can only be used if you take the first step. The journey of treatment can be daunting, but early action significantly increases the chances of a full and functional recovery. Surgeons can place a tiny metal clip at the base of the aneurysm to cut off blood flow and prevent rupture. Alternatively, they can fill the sac with platinum coils through a catheter, a less invasive option for many elderly patients. Rehabilitation helps retrain the brain pathways, allowing survivors to regain lost skills and return to their daily independence. Protecting your brain means protecting your memories, your personality, and your ability to connect with the world around you. Your health affects not just you, but everyone who loves you. Don't leave your well-being to chance or luck. We hope this detailed guide empowers you to be more observant and proactive about the health of the elderly. Please share this video with your family and friends. You never know whose life might be saved by this information. At Wellness Unfolds, we are committed to bringing you the most accurate and helpful health insights for a better life. Aging is a natural part of life, but suffering from preventable medical emergencies does not have to be your destiny. Keep looking closer, keep asking questions, and never dismiss a symptom just because it seems minor at first glance. Keeping a health journal can help you track changes over time and provide your doctor with valuable historical data. Build a strong relationship with your healthcare provider. They are your partners in navigating the complexities of the aging body. The human brain is resilient. Even after trauma, it has an amazing capacity to heal if given the right support. Every day is a gift. Let's ensure we live each one to the fullest by prioritizing our physical well-being. Save emergency numbers in your phone and know the location of the nearest stroke center or hospital with neurology capabilities. We have seen many patients walk out of the hospital because their family members acted fast on the symptoms we discussed. Your vigilance is the guardian of their vision, their memories, and their future. Be the eyes that watch over them. A healthy community is built on the safety and well-being of its elders. Let's protect them together with knowledge. Remember that what is good for your heart is generally good for your brain. Keep your cardiovascular system strong. Quality sleep is also essential, allowing your brain to flush out toxins and repair the daily wear and tear. Stay hydrated. Thick, dehydrated blood is harder to pump and puts more stress on your vessel walls and heart. Mental stimulation keeps your brain active, but remember that physical symptoms should never be ignored, regardless of mental sharpness. Chronic stress raises cortisol and blood pressure. Find ways to relax and disconnect to protect your arteries from damage. Nature walks and fresh air are excellent for reducing stress and improving oxygenation to the brain and body tissues. Incorporate omega-3 fatty acids into your diet to help maintain the flexibility and strength of your blood vessel walls. Limit salt intake and alcohol consumption, as both are known to elevate blood pressure and increase the risk of stroke. Home monitoring devices are affordable and effective. Make them a part of your morning routine to stay safe. Keep an eye on your cholesterol levels. Plaque buildup can harden arteries, making them more brittle and prone to aneurysms. When arteries become stiff, the pulse wave hits the vessel walls harder, increasing the chance of a bulge forming. Listen to your parents. If they complain of a strange headache or feeling off, take it seriously every time. Know your family history. If a parent or sibling had a brain aneurysm, your risk is statistically higher. Screening is recommended for those with 2 or more first-degree relatives who have suffered from this specific condition. Non-invasive scans like CT angiography can visualize the blood vessels in 3D and detect aneurysms before they ever rupture. The test is quick, painless, and provides peace of mind that is absolutely priceless for you and your family. We want everyone to enjoy their golden years with peace, dignity, and the best possible health status. You are not alone in this journey. Medical professionals are ready to help you navigate prevention and treatment options. Use technology to your advantage. Set reminders for medication and keep emergency contacts on speed dial for safety. If you are prescribed medication for blood pressure, take it exactly as directed. Consistency is key to prevention. Skipping doses can cause dangerous spikes in blood pressure, putting sudden stress on your arterial walls and aneurysms. Balance is everything. Balance your diet, your activity, your rest, and your medical care for the best results. Join support groups or health clubs. Staying socially active keeps the brain engaged and reduces the risk of depression. Happiness and a positive outlook actually boost the immune system and help maintain a healthier cardiovascular system overall. Visualize your health like a flowing river. Keep it clean, keep it moving, and remove any obstacles in its path. Sharing knowledge is an act of love. Send this to someone you care about right now to protect them. We thank the medical community for their tireless work in researching and treating these complex neurological conditions every day. Research is ongoing, and new breakthroughs are happening. There is always hope for better prevention and safer treatments. Life after an aneurysm diagnosis can be full and rewarding. Many survivors go on to live for decades longer. Our bodies are miracles of nature. Treat yours with respect, listen to its whispers, and it will serve you well. The most important takeaway from this video is simple. Do not wait. Doubt is the enemy in a stroke emergency. It is always better to go to the hospital and be told it's nothing than to stay home and suffer. Doctors would much rather send you home with a clean bill of health than treat a ruptured aneurysm later. Think of the moments you still want to experience. The birthdays, the weddings, the quiet moments with those you love. Protect those future memories by acting on the knowledge you have gained today about brain aneurysms and their symptoms. We are coming to the end of our journey today. We hope this information serves as a shield for you. This content is based on guidelines from leading health organizations, but always consult your personal physician for specific medical advice. The world is beautiful and full of wonders. Stay healthy enough to explore it and enjoy every single precious moment. If you found value in this video, please click the subscribe button and the notification bell to never miss an update. Check out our other videos on heart health and stroke prevention to build a comprehensive understanding of your body. Leave a comment below if you have any questions or experiences you would like to share with our supportive community. We truly appreciate your time and trust. Your health journey is our passion, and we are honored to guide you. Let Wellness Unfolds be your lighthouse in the often confusing sea of medical information. We are here for you. Health is a universal language. Let's speak it fluently together and create a world where preventable diseases are defeated. Together, we can make a difference. We can protect our elders and ensure their twilight years are safe and serene. Thank you for watching Wellness Unfolds. Please subscribe and share this vital information to save lives and protect your loved ones. Until next time, stay curious, stay healthy, and take good care of yourself. Goodbye, and see you in the next video.